I'm Kim Meredith, CEO of the San Francisco General Hospital Foundation, and I'm honored and delighted to welcome you here today to this session on innovations in public health, gun violence as a public health crisis. Our mission here at the Foundation is to fund and support patient care and innovation at Zuckerberg San Francisco General Hospital, because we believe in health access and care for all. Our supporters, many of you who are here joining us today, enable the life-changing and life-saving work that happens every day at ZSFG in ordinary times and in challenging times, such as during the past 18 months of this pandemic. Even during this global pandemic, gun violence has increased, devastating communities and reinforcing the need for leadership and policy change at the federal, state, and local level. According to a recent San Francisco Chronicle article, overall gun deaths have been surging in the Bay Area's largest cities, up by 35% in 2020 to a total of 285 deaths, and up by another 35% in the first 6 months of 2021. This past summer, we gathered virtually with Dr. Andre Campbell and Congressman Mike Thompson to discuss the need and importance of naming gun violence as a public health crisis. Joining us today to continue this conversation and discuss some of the root causes of gun violence seen at ZSFG Trauma Center and how the Wraparound Project is working to help guide victims of community violence through recovery and to reduce criminal recidivism is Dr. Rebecca Plevin and Michael Texada. Dr. Rebecca Plevin is assistant professor in residence with the Division of General Surgery at Zuckerberg San Francisco General Hospital. Her research interests include injury prevention, with a particular focus on underserved and vulnerable populations. Dr. Plevin is the director of the San Francisco Wraparound Project, the hospital-based violence intervention program at ZSFG. Michael Texada has worked extensively in the school system as well as juvenile detention facilities to provide monitoring and mentoring and case management to youth at risk. Wanting to facilitate and change at a citywide level, he began working with the Wraparound Project at ZSFG in 2005 as a caseworker. With that, please join me to welcome Mike and Dr. Plevin. Thank you for joining us today, this afternoon. When we gathered last, Dr. Campbell and Congressman Thompson painted a very vivid picture as to why gun violence is a public health crisis, citing common gun legislation and hospital violence intervention programs as tangible and effective solutions. So, Dr. Plevin, you lead Zuckerberg San Francisco General Hospital's Wraparound Project, a leading violence intervention program that is being replicated across the country. What makes Wraparound Project a leading and effective solution?
Hi, Kim, and thank you to you and to the San Francisco General Hospital Foundation for the opportunity to talk about what we do at the Wraparound Project. This is really exciting for us. I think that it would be helpful to start by giving some background about the history and the theory behind hospital-based violence intervention programs, or HVIPs as we call them. Wraparound was started, as you mentioned, back in 2005 by Dr. Rochelle Dicker, who at that time was a trauma surgeon at ZSFG. Wraparound was one of the first HVIPs in the country. And at that time, violence intervention programs were this new and untested idea. Over the last 16 years, based on data demonstrating the efficacy of these programs, HVIPs have now expanded throughout the country and even internationally. And in addition, the theory behind HVIPs is no longer new. So let's talk a little bit about that theory so we all have kind of similar understanding. Research shows that when a person sustains a non-fatal violent injury, their risk of then sustaining a second or third or fourth violent injury in the future is significantly increased. And this has been shown over the years in many studies. And this provides an opportunity for intervention because it allows us to identify a group of patients at the hospital who've been violently injured once and are thus at risk of a second injury, which we can then work to prevent. So that's sort of the first underlying theory behind HVIPs. The second underlying theory, and one that Dr. Campbell spoke about previously, is that gun violence is a public health issue. And like all public health issues, it has underlying risk and protective factors that either increase or decrease a person's likelihood of being violently injured during their lifetime. We know that victims of gun violence are overwhelmingly members of communities that are underserved and under-resourced, including our Black and Latinx communities. Structural racism and the resulting inequities in social determinants of health are the drivers of high rates of violent injury within these communities. HVIPs work to prevent violent injury by providing tailored case management services and resources to address these underlying inequities in social determinants of health. So what does that mean? It means that being violently injured is not just about being in the vicinity of a knife or a gun. It's about much deeper societal issues and structural racism that prevents our clients over their lifetime from accessing resources and opportunities that are available to others. Wraparound provides case management and partners with a wide variety of community-based organizations to provide these resources and opportunities that would be most impactful for each client. So how do we do that? When someone's assaulted in the community and comes to ZSFG, he or she is evaluated by one of the wraparound case managers to assess that individual's risk of re-injury and to offer case management services and resources. We introduce wraparound during what we call the teachable moment, which is that period of time after a violent injury when our clients are reflecting on what happened and may be more open to offers of support and assistance than they would be otherwise. This brings me to another key component of HVIPs, our case managers. HVIPs hire case managers who are either from or who have deep ties to communities that are disproportionately impacted by violence. At Wraparound, our case managers have had many years of experience working and interacting in these communities. And this is important because in order for Wraparound case managers to provide services, they need to be able to quickly and effectively build trust and rapport with clients during that teachable moment after the injury. Having culturally concordant case managers is critical to achieving that goal. And I'll defer to Mike to talk about this in more detail because he's the expert on how our case managers are able to be so effective at providing services to our clients.
Great. Thank you, Dr. Plevin. That was really a great summary, and I think for everyone to understand those three components. So thank you so much. You noted that one of the integral parts of the wraparound is its case management. So, Mike, you've been at Wraparound for 16 years and have seen firsthand the impact of your work and your colleagues' work. So what inspired or motivated you to do this hard and much needed work? You've really dedicated your life to this.
Yes, Kim, and thank you. Just to echo what Rebecca is saying too, yeah, case management is really a key part. For me, it's a little rewarding, but it's also challenging. And I got involved because I seen an array of violence in the community where I grew up. So I really wanted to be part of a solution instead of being part of the problem. So that's really what got me involved into the wraparound and also just into juvenile systems, working in the school districts, and really just trying to get a handle and provide the best services possible.
So thank you. You're really meeting people where they are and using what I would consider a humanistic approach to your work. So when you're treating persons who are victims of gun violence with the hope that they won't be repeat victims, Dr. Plevin, what does that look like at ZSFG, building off of what Mike just shared with us?
Yeah, Mike makes a really good point about meeting people where they are. And when a patient arrives at ZSFG after a violent injury, I have two main priorities. My first priority is, as their trauma surgeon, I need to address the injuries and make sure that they'll physically be okay. And I think it's important to understand that in addition to the trauma of the injury itself and what just happened before they arrive, the experience in the hospital in those first few minutes can be traumatizing as well. Some of our patients arrive unconscious, but many of them are actually awake. And for those that are, they're wheeled into a room that's full of bright overhead lights. There are often 10 to 15 people in that room. And because our patient is on a gurney or bed, all of those people are looking down at him or her. We try to speak as little and as quietly as possible, but there's a lot of conversation happening in the trauma bay. And lastly, there are a lot of hands who are touching the patient as we work to assess their injuries and figure out what needs to happen next. Many of our patients go directly from the emergency room to surgery, where we address the physical injuries. So the team in the emergency department tries to make this process less frightening. We try to explain what's happening, talk our patients through each step, and provide reassurance. But it's incredibly hard to prevent this from being a really scary time. And I share this because I think it provides additional context to the amount of stress that our patients are under and what they've been through before they even meet one of our wraparound case managers. So once the dust has settled and the patient is medically stable, perhaps they've had an operation, perhaps they haven't, then my next priority sort of changes to engaging wraparound and starting to address the other issues that need to be addressed. The surgical team reaches out to wraparound as soon as a patient arrives. So our case managers are ready and waiting to visit with a patient once he or she is stable. And this is where the real work of the HVIP begins and where Mike and the team really shine. And Mike, we already mentioned the concept of meeting the client where they are, but it's really important during that first visit. The case managers can be an ear to listen or provide a service to the client as a way to engage and start developing that really critical rapport. And from there, the door opens to all of the resources that wraparound can provide.
Thank you. Thank you, Dr. Plevin. That was really quite an extraordinary summary of what it feels like for the patient to come into the emergency department and then the surgical bay. and just I mean, I could feel exactly the stress that they would be feeling as they came into that, and how meeting people where they are and talking quietly and trying to, manage that relationship with the patient in a way that they're respected, but also feeling taken care of, but minimizing the fear. So when we think about that piece and then move into the meeting people where they are, Mike, in terms of case management, what does that look like from your perspective as somebody's either handed off at that point or in the near future?
Yeah. Really just to provide, to build a rapport, really having a conversation with individuals that are coming in who are enduring trauma, because they're scared, like you said, they're in fear. They may not know which way to turn, right? They may not even know what's available to them, but also, they may have had a job or something before they arrive to the hospital. And, really it's key to know, did somebody call their job for them? That do you need, to ask them, do you need me to call your job? Do we need to notify your boss? Things of that nature, right? But also just really trying to, have a conversation to see what's most needed with that individual and get to know them and get them to trust you as well.
So it seems like you're trying to intervene early. And so how does that early intervention affect their ability to recover, minimize potentially re-injury? What does that look like to you, Mike, when you're thinking about sort of how you take the initial case management step about just reaching out on their behalf and then sort of moving them into phase 2, if you will?
After you have that conversation, and really just seeing what's the needs they may need, let them know that these resources are available, resources like workforce development, court advocacy, mental health services, because, they just been a victim of a violent injury, right? So really just offering services that can, help them in their recovery and them healing, right?
So mental health counseling, I was just making it, housing and employment are 3 of the most common client needs that we would see with somebody coming into the SFG. So how does the SFG help provide these services to its patients? And are there times when you're also helping family members of the patient in those 3 categories of mental health, housing, and employment?
Yeah, really, we have the good thing about the city, we've been blessed with a lot of resources. And just really knowing your partners, having conversation with your partners to let them know, and to be able to be there for the clients for those resources and those services, right? And really going with the client to let them know that you're going to follow through with them to help them get these services, because some of them don't know how to access these services or even know they exist. So really just, letting them know that I'm here to help you. I'm here to be your support system of care as well.
So Dr. Plevin, we've just heard mental health services top of the list in addition to housing and employment. So when you think about the Trauma Recovery Center, what do you think about when you think about mental health services and how the team can help the individual who is trying to recover from a violent injury?
Well, as you would expect, in addition to the physical trauma of a violent injury, these injuries also cause emotional and mental trauma. As I said, this is a really scary time for our clients, and we think that it's as important to address the impact of the injury and hospitalization on their mental health, just as we address their physical injuries. We think that mental health impacts everything. With respect to employment, our clients often deal with physical challenges in the workplace from their injury. And then added on top of that are the challenges that come from acute stress disorder or PTSD or depression as a result of their trauma. And when you add that, it can be very challenging for a lot of our clients to function in a workplace or to proactively seek employment once they're discharged from the hospital. It's a lot. Mental health is one of the key resources that Wraparound facilitates, and we do so through a partnership with the Trauma Recovery Center, TRC, as we call it. And through this partnership, we have a mental health specialist who's embedded with Wraparound for several days each week. And the reason that we did that is there's a lot of stigma around mental health and what it means to seek mental health care in many communities. And as a result of that, it can be really challenging to even broach the subject of mental health care with our clients, let alone get them to speak with a mental health specialist. I hear in the hospital not infrequently, mental health care is only for, quote, crazy people or, something similar to that. And that makes it really hard to open a conversation about having a mental health specialist come and talk to our patients. What we found is that our clients are much more interested and likely to work with TRC when the idea of mental health care is introduced by one of the case managers first, instead of a TRC member showing up at their room unannounced and saying, I'm here to talk to you about your mental health. The case managers from Wraparound are able to introduce the idea using different language and not talking about it in terms of mental health care in a way that really encourages our clients to engage. And we've had a lot better success using that model with getting our clients into TRC.
Great, thank you. Dr. Plevin, you've also been quite an outspoken advocate for gun control. And so just a little pivot here around what you've seen over the past 16 years in terms of the landscape on this hospital violence intervention and other work that might tie in from a policy perspective.
Well, with the caveat that I have not been here for the last 16 years, but, I have been a part of this community for a number of years and work very closely with many of the founders of HVIPs throughout the country, including Dr. Dicker. I think one of the biggest changes nationally is that there are now more than 40 HVIPs in the country. And there's a national network called the HVIP that conducts violence intervention research, that provides support to frontline workers and case managers. The HVIP advocates for funding and for violence prevention initiatives, and it also provides mentorship to new HVIP programs. So as one of the oldest HVIPs in the country, Wraparound has the opportunity to help in this way. We delivered tailored trainings to new programs to help them get off the ground, to address specific challenges within their hospital system, or to help them avoid some of the mistakes that HVIPs made early, in the early 2000s when this idea was first being developed. And that, I think, has really streamlined the extension and expansion of HVIPs nationwide. I think as a clinician that there's a lot more social consciousness today among trainees about the impact of violence and the underlying risk factors for violence. I'm constantly impressed by the sophistication of the medical students and the resident physicians that I work with when it comes to these issues. They have a level of understanding about structural racism, about social determinants of health that's really wonderful to see, and that I don't think that I saw even in the early years of my training. And what that means is that they don't need to be convinced that programs like Wraparound matter. And that gives me so much hope about the future of HVIPs and the future as it speaks to gun violence.
Great. Thank you for all of those insights. And in fact, there's a question from the audience that really works perfectly off what you just said. Knowing that there are 40 HVIP programs nationally, how does this play out in rural communities, smaller communities, as compared to a place like San Francisco?
Yeah, I think that's a great question. Many of the HVIPs are focused in larger communities and cities, but I think gun violence occurs in smaller communities, and it also occurs in rural communities. And I think that even some of the smaller trauma centers in these communities would benefit from having HVIPs. Perhaps they wouldn't need, a full staff of the size that Wraparound needs in order to provide services to San Francisco, but gun violence, as we know, is a problem nationwide, and the risk factors and issues that perpetuate gun violence in smaller communities and rural communities may be different than they are in larger cities, but they still exist. And so they still need experts who are going to pin down what those risk factors are and be able to locally address them to try and decrease gun violence in those communities as well.
Okay, thank you. That's really helpful to think about. And then also, I think really a call to action for all of us listening is, how can we get out the word that there actually is this expertise here in our community and that there are 40 around the country? How is there, again, I think you mentioned there's maybe like a national network that if people wanted to look up which communities are actually a part of this network, if you will. Could you share that again?
Yeah, absolutely. The national network is called the HAVI. It's HAVI, and I can put the URL for the website in the chat so that everybody can look it up if they're interested. The other groups who are very involved in gun violence prevention are the American College of Surgeons, which has an injury prevention task force that's run by many of the leading experts in the development of HVIPs nationally. Trauma surgeons, as you might expect, have a long-standing interest in putting ourselves out of business as it pertains to gun violence. And the American College of Surgeons has been a great supporter of this work as well. In addition, many of our emergency medicine colleagues are advocates as well, since they are as much as us and really more on the front lines.
Great, thank you. And maybe we can share that as part of our post-event follow-up. So thank you, Rebecca. That was great. Mike, it might be wonderful to hear from you about what does a successful client story look like? And sort of what impact does your work have in the real world with them?
Really, when you get a client who really probably didn't believe in themselves. And once they access the services, right, and, they get plugged into college or employment and see that they can really go ahead and get that job and, start working again and, just seeing their life changing. It's life changing, but also just letting them know that, this stuff is here for you. and I'm gonna be here for you, you know, to get you these needs, you know, to get the needs that you really want, something that you really feel comfortable in doing, right? College and, you know, jobs and really just seeing, you know, some of the young folks. I mean, I have young people call me and say, Mike, you know, I just want to properly thank you for helping me get this job or helping me get back into college or, you know, things like that, right? So, you know, that's exciting and rewarding for them and for me.
Absolutely. Dr. Plevin, is there a particular story that or somebody that you cared for that comes to mind about, you know, kind of that, you know, it was sort of a life-changing moment, and with your work combined with Mike's work that it helped put somebody on a path forward?
I think for me, a recent client, and I won't share too many details, but we have one client who was injured and started working with one of our case managers, and what he really wanted was education. He wanted to be able to go back to school, and he didn't have the resources to do so beforehand. He, you know, things like funding to get a computer because it was COVID and everything was happening remotely. And then you need a computer to take your classes and do your homework. Small things like that many people take for granted, he didn't have. And we were able to provide, number one, the resources to give him the physical things he needed, but also through the really dedicated support of our case manager, cheering him on with all of the successes, you know, talking him through the setbacks. He's doing a fantastic job working his way through getting an education. And I think that to me is just so amazing to see. And then as a clinician, you know, I treat our patients in the hospital and I take care of them for days to sometimes weeks at a time in the hospital. And then, you know, I may see them in clinic for a visit after that, but I often wouldn't see them long term, except that they'll show up at the wraparound offices to see their case manager. And there's just something so heartwarming and gratifying to see somebody who I last saw as a patient in bed wearing a hospital gown, you know, out on the street, you know, living their life, wearing regular clothes and excited about what they're doing next, you know, to achieve whatever their next goal is. That type of encounter really, to me, provides a whole new layer of satisfaction and love for what I do that I wouldn't get just from the clinical care we provide.
Thank you. Thanks. That's a great story. And it really leads into the next question that has popped up. Mike, this one's for you. You know, when we hear like seeing somebody in the street or in the wraparound offices, how does your work affect the entire community, and what's the ripple effect? Do some of these individuals who you've worked with know each other? Do they come together? Are they sharing a message, or is it more quiet and very individualized and you're out there in the community? How does all of that look?
Good question. I think, you know, to know that wraparound exists, right? Mm-hmm. And also to just really know that, you know, you have case managers who can really help individuals that's coming from these communities that's impacted by a lot of violence, right? To know that, you know, you have people who grew up in your neighborhood or who come from your neighborhood to really show that, look, I'm here for you. We're going to get through this. Let's change the dynamics of what happened. Let's look at it from a different light, right? And that light is really getting folks to a place where they're comfortable, where they're safe, where they feel like they appreciate it, where they feel like, you know what, this is my community. I should be able to get these services. I should be able to be in college. I should be able to be employed, things like that, right? So I think it's just really important to really put a light on the success of individuals who are impacted.
Thank you. Are you also engaged in any way, Mike, with some of the gangs in trying to have discussions about violence in a preventative way, or if one of their members has been a victim, using that as a way to connect with some of these gangs and trying to help the community in that way?
Yes. And prevention is a good part of it, right? And mentorship, right? As Rebecca was saying. I mean, having a good mentor, having somebody who once was started out in that direction, but then changed their life around and now can come back and show you how they did it, right? To help that person to understand that, look, it's a better outcome. It's a better light, right? It's a better situation. It's a better way to handle things, right? So that mentorship is really key, but also having services that are really a reality, and not promising folks something that you can't deliver. We're big on that too as well. We want to make sure you succeed. We don't want you to fail. We don't want you to have to resort back to the streets or to the old ways of what was going on in the streets.
So go ahead.
So sorry, Kim. Maybe you could talk a little bit about City Hall and the partnerships with SVRT as well.
Yeah. So, and you're right, Rebecca, and it takes the village. And that village is the partnerships, right? We have a street violence intervention program that's through the mayor's office. We also have a lot of CBOs who have facilities right there in the community, right? So it's really about, having those partnerships, having those collaborations, having those meetings to address, all the problems that's happening, right? And getting folks involved who folks really, feel comfortable with. But yeah, street violence intervention, them guys is amazing. They do a lot of stuff, a lot of services, safe passages. They also, they do a lot of stuff. So, and that's good because we have a strong connection.
Yeah, I think it's important that that this discussion touch on the fact that this is a web of resources and people and organizations. This is not wraparound out doing violence prevention. There is, partnerships, as Mike mentioned, with City Hall, with juvenile detention, with the school district, so that if we have a teenager who's been injured, Mike can work with individuals at the school district to make sure that their education stays on track or gets back on track if it wasn't. We provide direct case management for many of our clients, but we don't try to reinvent the wheel because there are so many amazing community-based organizations that are providing all kinds of services within San Francisco. So a big part of what our case managers do is they spend time getting familiar, being familiar with these programs, making sure that we have people working at each of those programs that we can reach out to directly, so that if we send them a client, we can check in and ensure that things are going well and the client is progressing, or address any problems that come up. And it really is just this complicated sort of spider web throughout the city of organizations that are all working synergistically to provide case management. Wraparound, our case managers are a critical first piece, but this is really just a huge team effort.
Thank you. It really raises a question around kind of investment into direct services, policy, research, and then how to scale or leverage those three elements, if you will. What do you see as the balance in that investment of time and money and human capital?
Yeah, I think at the most basic level, over years, many violence intervention programs have struggled to identify secure funding. And Wraparound has been very fortunate in our support from the city and our support from the foundation. But for many programs, they've operated on grant funding. And for a program that is predicated on developing deep relationships with the community, it's hard to feel secure doing that and be secure doing that when every year you're having to try and find funding in order to keep the lights on and keep the trains running. So at the most basic level, I think secure funding for operating costs is really important. I think research and developing next step tools is probably the next funding priority. We are still working on how to scale up programs more effectively and more efficiently, because as you might expect, the work that our case managers do is incredibly labor intensive, and there are only 5 of them. They are people with lives whose health and mental health is also incredibly important, and finding a way to scale up the work that they do and taking some of the burden from them is one of our areas of research as well. So I think those are kind of my 2 main priorities.
Great. Mike, do you have other priorities that you would add into what Dr. Plevin sees as top priorities?
Yeah, it's just really making sure, the self-care for, frontline workers is really key. Making sure, they don't burn out, that they're taking care of themselves too as well, right? Because the work can be a little challenging and intense, but also, growth and development, that's key too, right? Because things changes and, development is, trainings, things of that nature is really key too on, how to be successful to help somebody. So.
Great. All right. Thank you. So one other question, how do we get to a point where wraparound is not needed? Can you ever envision that type of a world? What would a gun-free community look like? And have you actually seen any communities that have really been successful in that way? Dr. Plevin or Mike?
Well, I personally have not seen a community, at least not here, that has gotten to that point. I think that in order to put ourselves out of business, we need to continue supporting community-based organizations that are doing this important work to provide resources to victims. And I think advocating locally as well as at the state and national level for funding to support these programs, and really embedding the idea that healthcare includes care involving social determinants of health, and that the work that our case managers do is an integral part of healthcare. I think, maybe one day we will get to the point where we are addressing social determinants not in people who've already been injured, because you could argue that that is already one step too late, but we really need to be proactively addressing these inequities one step upstream before people come in injured for the first time. And that just needs to be the direction that we as a country and we as clinicians move, and a commitment that we need to make to everybody in our communities.
Great. Thank you, Dr. Plevin, for that. And thank you, Michael, for all your insights. So I have one final question for each of you. We've answered all of the audience questions at this point. So Mike, you've seen the ups and downs of the Wraparound Project and have developed many meaningful relationships with patients over the years. And you've been sharing sort of on a broad basis, examples of how you've affected people in terms of their mental health, their employment, their housing, jobs, and school. So what gives you hope preventing gun violence and interrupting the cycle of violence through the Wraparound Project?
To where our young folks don't need the Wraparound Project. When they can sustain on their own, where they can teach and actually do a lot of prevention to younger folks, to folks in the schools, to really get involved with prevention. And there's a lot of groups out there. But yeah, I think, going back to what Rebecca said, it's really key supporting the community-based organizations as well, right, that are doing prevention work. I think even for me, working in the school district and, elementary schools, that early prevention, right? Childhood prevention, right? So yeah, I would love to see a lot more of that. And I'm glad it's happening.
Great. Well, thank you for all the work that you're doing. I mean, it's really extraordinary. And Dr. Plevin, a final question for you. What gives you hope for the future about preventing gun violence, preventing re-injury, and what Wraparound offers?
I think for me, the things that give me hope, one of them is what I mentioned earlier, which is the change I see in our trainees and young physicians and young healthcare workers who are coming up through their training, and the just higher level of understanding that these issues matter, that they are important, and that they are healthcare, that social determinants of health are absolutely critical. That wasn't something that that was highlighted to me even in my training, and I imagine that it was even less so back when HVIPs were first developing. So that kind of societal change within the medical community makes me really excited and hopeful. And as Mike mentioned, the level of advocacy and involvement from the community itself and from this huge network of community-based organizations, it gives me confidence that we as a society are going to keep speaking up until every member of our community has the tools and has the resources that they need to lead a healthy and safe life. So we're not having to jump in after that injury has occurred, but we have already addressed the issues that put them at risk of having that injury in the first place. And I think we're moving in a really good and positive direction as a country and as individuals towards trying to support one another.
Well, thank you, Dr. Plevin, for that. And thank you, Michael. The work you're doing is truly inspirational. Your commitment and dedication to our community as a surgeon, leading the Wraparound Project, the combination of the two of you really is making a difference in our community. So thank you, Michael. Thank you, Dr. Plevin. And thanks to all of you, our supporters, for joining us today. As you know, we can't do our work if we don't have your time, your energy, your interest, and your support. So thank you for joining us and continuing to be a part of our community as we support the work at ZSFG. Gratitude to all. Have a great afternoon. Thank you.